A 30-year-old woman presents with anxiety, weight loss despite increased appetite, heat intolerance, and palpitations. On examination, her heart rate is 112 min and irregular. She has warm, moist skin and a fine tremor. Her eyes appear prominent, and her thyroid gland is symmetrically enlarged and non-tender. Laboratory tests reveal TSH, free T4, T3, positive anti TSH receptor antibodies. Which of the following best explains the pathophysiology of this patient's condition? A. Destruction of thyroid follicles by cytotoxic T cells. B. Antibodies blocking the TSH receptor. C. Antibodies stimulating the TSH receptor. D. Pituitary adenoma producing excess TSH. E. Increased conversion of T4 to T3 in peripheral tissues. Correct answer, C. Antibodies stimulating the TSH receptor. Explanation. Graves' disease is caused by thyroid-stimulating immunoglobulins, TIEs, a type of anti-TSH receptor antibody that mimics TSH, leading to increased thyroid hormone production. A. Destruction of thyroid follicles, seen in Hashimoto thyroiditis. Blocking TSH receptor, seen in hypothyroid autoimmune conditions like atrophic thyroiditis. D. Pituitary adenoma would present with high TSH and high T4, secondary hyperthyroidism, but TSH is low here. E. Increased T4 to T3 conversion does occur, but doesn't explain the autoimmunity or TSH suppression. Question 2. A 42-year-old woman with a known history of Graves' disease presents with eye irritation, a gritty sensation, and double vision. Examination reveals exophthalmos and restricted extraocular movement, especially on upward gaze. Despite normalization of thyroid hormone levels with methimazole, her eye symptoms persist. Anti TSH receptor antibodies remain elevated. Which of the following best explains her persistent ophthalmopathy? A. Persistent thyroid hormone excess. B. Cross-reactivity of antibodies with orbital fibroblasts. C. Infiltration of extraocular muscles by thyroid hormone. D. Iodine deficiency causing orbital myxedema. E. Compression of the optic nerve by a goiter. Correct answer, B. Cross-reactivity of antibodies with orbital fibroblasts. Explanation. Graves' ophthalmopathy is caused by anti-TSH receptor antibodies binding to TSH receptors on orbital fibroblasts, leading to fibroblast activation, glycosaminoglycan deposition, and inflammation, even when thyroid hormone levels are normal. A. Thyroid hormone excess, eye symptoms can persist even after normalization of hormones. C. Thyroid hormone does not directly infiltrate tissues. D. Iodine deficiency is not the mechanism in this autoimmune condition. E. Goiters don't typically cause optic nerve compression or exophthalmos.